Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Welcome back to our next episode of Between Two White Coats. And Amber and I are thrilled to have our dear old friend. I'm not calling you old, I'm saying that we've been friends for a long time.
Yeah, right. She's not old.
She's not old.
People, she's not old.
Jane Robinson is back. Jane has done episodes with us in the past where we've talked about depression and anxiety. We've hit a lot of different topics. Jane sees clients here in our wellness center, and she has helped us co-manage so many people in the world of mental health, and we greatly appreciate you and all the work you do. Today we're talking about a very important topic, insomnia. People have bad sleep, and it is life-changing when you have bad sleep. And you're going to help give us some extra tools for people who are struggling with insomnia.
Yes.
Thank you so much, and thanks for joining us again, Jane.
Thank you for having me.
I think often
Thank you.
You said extra tools, and I think when most people hear insomnia and they hear us talking about it, they think we're going to give them medications.
Yes, and so many people are just, I don't sleep well. Some people, it's rarely the chief complaint. It's sort of, we've talked about all the other stuff, anything I'm missing, well, I'm really struggling with my sleep. And I don't think people realize, well, if you're really struggling with your sleep, that's profoundly impacting everything else. So
Well, and sometimes in our culture, we will wear a badge of honor. Well, I can get stuff done on 3 hours of sleep. The inability, or I guess the ability to function with little sleep is almost like a badge of honor.
Yeah.
Like, oh, well, I don't need that much sleep, or I stayed up all night to get that done. And it's like almost praised.
It is. And we do an entire podcast early, I think, in our first year about sleep and the importance and what happens in sleep. And to your point, Amber, really the prescription medicines should not be solution number one. Prescription medicines can knock you out. They can make you fall asleep, and they can make you stay asleep. They're sedatives, but they do not help you have a normal sleep cycle. So when you sleep, you should go through non-REM sleep, 3 stages of that, into REM sleep, and then repeat. And the first half of the night's more non-REM, and the second half is more REM. And when you do all of that, your mind is repaired, your body is repaired, and you wake up feeling refreshed. What sleep aids do is really not allow you to go through that normal cycle. So when you're taking Ambien or Xanax or Klonopin or all of the sleep aids, there's a lot of them on the market. Not only can they be habit forming, but they also disrupt your sleep cycle. So what we would rather do is help you actually get to the core of what would help you sleep better. So before we jump into some different therapies that can help with that, let's just talk about sleep hygiene real quick. This is the idea that you can't just go from I'm running wide open to, and now I would like to lay down and fall asleep. And that we need to have certain patterns. So what advice do you guys typically give people on just even the sleep hygiene end of things, on what do you need to do to have a better sleep preparation so that you will sleep better?
Okay. So one thing that a lot of us do is we are on our phones.
Yes, we are.
Yes, we are. Until we go to sleep, and I'm kind of guilty of it myself. And so limiting that screen time before bed, even turning the TV off.
Yeah, and there's a lot of research that supports kind of, the blue light that comes through the screens, and the blue light helps kind of even work on your subconscious so that you don't fall into deeper sleep, and will also mess up your quality of your sleep.
I didn't even know that. That's
interesting.
interesting.
And so if you sleep with a TV on, it may be disrupting how deep you actually get into sleep. And so turning off the screens before and during sleep is really important. And that makes me think too, you can't go from on and thinking about and worrying about to deep and meaningful sleep. So taking a transition period between work and being on your screens and doing things that are stimulating. I wish the 11 o'clock news wasn't the 11 o'clock news. Like,
right.
Don't watch that and then try to go to sleep, because
right.
that's not going to help you rest.
Yeah.
But trying to transition from doing to not doing is helpful, and take a little window of time to where you're not trying to pound things out, do the laundry, catch up on your emails, and then think you're going to lay down and fall asleep right away. Other advice that you give people in that kind of transitioning and sleep hygiene?
I think often do what works best for you. I take a bath every night. It doesn't matter if we get home at midnight for whatever reason, or it's just my pattern, because I just need to, I call it woosah. I just need to chill. And of course, often after I get a shower in the morning and I take a bath at night, it's kind of my pattern, and I'll often read. I love to read, and a lot of times read not heavy stuff at night. My fun fiction stuff is what I'm reading. So a lot of times I'll just read, but often patients don't know what they like or what would work for them. So sometimes you just have to try things out. Maybe you're good with tea. I know you like some teas.
Yes,
meditation.
Yes, I like my sleepy time teas, my evening teas, chamomile, lavender. And green teas.
And I think tea's
have
gross.
Yeah.
So,
so
it's not a one size fits all.
Don't do the gross stuff before bed. But I often equate this to when we are trying to get children or newborns to sleep. We don't say, I'm going to feed you, we're going to play, and then put you in the crib and walk off. There's an entire pattern that tells babies, this is what we do, and it starts making us tired, and at the end of this, we fall asleep. And so then we keep that pattern, and we're really good about, if we don't have our pattern, they won't sleep. And then one day we think that when we, get fully grown, that our brains are totally different. But the fact of the matter is that you need that pattern that starts training your brain to say, and when you do these things, it's now time for sleep.
I never have a problem going to sleep. My head hits a pillow and I'm out.
But you have this pattern that your brain
forever.
knows, no matter what time it is, this is what we're doing, and then we fall asleep
and
afterwards.
I always will say too, you mentioned screen time, but limit caffeine.
Yes.
Make sure, there's always the things about the temperature, making sure it's cooler, or you're sleeping in something cooler.
Dark makes you sleepy. So, if you're struggling to fall asleep, there are different types of insomnia: falling asleep, staying asleep, early awakening. If you're struggling to fall asleep, you might want to put yourself in a cooler temperature. Your normal circadian temperature is lower at night. So when you cool down, so make your room a little cooler, make it a little bit darker, and try to be committed to a specific bedtime. And so you can't go to bed at 9 o'clock every night and then think, oh, I'm gonna go to bed at midnight, and then I'm gonna go to bed at 7, and then I'm gonna hit 9. Your body's not going to know what time it's supposed to fall asleep. So having a pattern and a routine is going to help your body and brain to know
awakening
what's happening
too. So getting to bed at a certain time and then sleeping. And I know that you mentioned circadian rhythm, and there's a lot to be said about the 10 to 2 window in our brains, and that's kind of like the melatonin, serotonin exchange that happens at that time period. And so making sure that you're getting to sleep. I will tell patients, you need to be in bed by 10.
Yeah. And a lot of, and like you said, everyone's a little bit different, but knowing yourself and our circadian rhythms really dictate how good our sleep cycle is going to be. I also think you falling asleep at the same time, waking up at a similar time, and not doing a lot of sleeping during the day. Daytime napping can mess with, and we certainly have patients where they get their day and their night mixed up. And so some of our older people, I've just retired and I'm just laying around all day and then I can't sleep at night. It's you got to get up and tell yourself that it's day and be doing things, and then you'll be able to sleep better at night. So if you're doing those things, and you really struggle with insomnia, and I think insomnia is, a lifelong problem for so many people. I've never been a good sleeper. Tell us about some of the therapies that can happen that, I think a lot of people think I'm either not going to sleep or I'm going to take a pill to sleep. What are the other options?
Okay. So there's cognitive behavioral therapy specifically for insomnia. And what we address is if the person is having stressors that are keeping them from sleeping. So we look at the cognitive part of it, the thought process part of it. If possibly they have anxiety, that can be keeping people from sleeping. And what I've noticed with a lot of clients and people that I know, when they lay down, of course, everything's quiet. So during the day, you're up and active and all, but when you lay down, then the mind starts, okay, starts the ruminating and all of that and worrying about, okay, what happened today? What have I got to do tomorrow? And so trying to help people explore what is it that is keeping you from sleeping would be, that's one of the processes of this CBTI. Another thing is the relaxation process, breathing exercises, meditation. Meditation actually, Rutgers has done a study that meditation actually increases melatonin. So, progressive muscle relaxation, teaching people those kinds of things can, very definitely help. And there was something new in this that I learned that's interesting, I think is called sleep compression, where people go to bed maybe early and they lie there for, like an hour trying to get to sleep and tossing and turning.
And getting annoyed because they're not asleep yet.
Yeah. So what we would do is look at how many hours this person is actually sleeping, add 30 minutes to that, and then calculate what time they need to go to bed, what time they need to get up. Because we need to try to limit that tossing and turning time as well. And, looking at their thought patterns about sleep, right? If they've had insomnia for a long time, is there any time that we can pull from, maybe a solution-focused type therapy that we can pull from when you were able to sleep? What did work, right? So, and then of course the sleep hygiene is a big part. Limiting alcohol and eating before bed. People think that alcohol, I passed out from alcohol.
Right.
That's a good thing, right? I slept. Yeah, right.
Exactly.
Right.
And alcohol is one of the things that is most disruptive to your sleep patterns. And so most of the time I think people will also realize if they had a episode of drinking and then passed out or just fell into what they thought was deep sleep, they're dead tired the next day. Like it takes days to recover from that because you were passed out, you weren't sleeping. You really weren't getting restorative sleep. And so yes, limiting alcohol so that you can not disrupt your sleep pattern is huge as well. I like a lot of the things that I hear you saying because I think that once people put themselves into the I have insomnia category, then they develop a very unhealthy relationship with sleep. They dread the evening. They know I'm a bad sleeper. They put themselves into the me, sleep, not friends. We just don't do well together. And so just reshaping that can start to help people. And then giving them tools, because if you already feel like I'm going to lay down and all this bad stuff's going to happen, then there's the self-fulfilling, you can help create it if you believe it. And then it just doesn't go well. So then you're getting agitated while you lay there. And you feel fairly victimized by this. It's I don't have control. I want to sleep, but I don't have control over the sleep. So then starting to learn some tools. So instead of laying down and being focused on the fact that you're gonna lay here, toss and turn, and then don't lay here and toss and turn.
Right.
What other and sometimes we do what we do until someone helps guide us to something better. But then also learning these tools of deep breathing and mental relaxation tools, so that as soon as you get in the bed, you could go straight in to learn to these exercises, empower yourself to know I can do something about this, and then use those tools to allow your brain to be focused on that instead of your brain being focused on I can't sleep.
Right. And so the guided meditation, I personally use that almost every night.
I love
because
that.
It distracts it.
Talk
distracts
to
your
us
brain.
about what is guided meditation. What does that look like?
So it's where you are listening to someone guide you through the meditation, because I have clients who say I can't just sit and be quiet, right? Because again, you've got the brain ruminating. But if you can listen to someone guiding you through the meditation, or even like you were talking about reading, you could listen to a book on Audible. Okay, something that's distracting your mind from you thinking about sleeping or whatever the anxiety of the day is. Right.
And so are there apps or other things that if people wanted to try like guided meditation for sleep that they could jump into?
I use YouTube.
Yeah.
They have everything.
They do.
I just want you to know that
About
as we're sitting here,
everything.
I have tried to hold in a yawn like 10 times because we're talking about sleep.
Sleep. Yeah, so your brain already. So Amber has the opposite of insomnia.
I'm
where
like, y'all
she's like,
about
ooh,
getting sleepy.
I
We
love
have a blanket and a
it.
pillow. I'm hot already. I'm feeling really
We're
cozy
good.
in here.
We're
I'm super relaxed. Let's go to sleep. Thank you, Jay.
I'll obey you.
I'm
if
like,
you fall
I'm
over.
about to yawn. Okay, back to your YouTube.
That's good.
Yeah, so YouTube does have everything.
They do. And you can specify, do I want to do, like sometimes I'll do heart healing, or sometimes you can do just for sleep. They have specific for anxiety. For body healing.
Yeah, and you can choose someone that you like, and if you're using, who knows who you can find? Who can you find on YouTube? Anyone that you find on the web. And so, if someone you're like, oh, that's not really resonating with me, then switch channels.
Right.
Find someone else on YouTube.
Right.
But there's lots of good therapists, and there's different meditations and yoga that you could do at bedtime. It could be part of your sleep hygiene where and you can I'm a Peloton person, and Peloton has every imaginable class, and so they have relaxing meditations that you can do before bed, and you can choose 5-minute, 10-minute. So you can very much structure it to what's going to work for you, but that's a great idea.
How long would someone, I know it's so individualized, so this is just not a fair question. I know that as I'm about to say it. But like, what would a therapy session look like, or how long would the process take? Like if you're doing CBTI specifically for insomnia, which is what that stands for, how long? Like what would a patient expect?
About 6 to 8 sessions, and according to the Sleep Foundation and the Annals of Internal Medicine, it works for about 70 to 80% of patients with
that's
insomnia.
better than drugs.
Wow, that's so much better than drugs. It is so much better than drugs without the adverse side effects.
Yeah.
And you've empowered people to know that they can take their sleep back. They don't have the adverse side effects. They're getting regular quality sleep.
Well, and let's be real, like you're still doing CBT. So if they're dealing with anxiety, you're also addressing that.
Absolutely.
Along with their insomnia.
That's right.
But so it's kind of a win-win if you're like, well, I'm not sleeping, and then you realize it's because I can't stop thinking about whatever from whenever, and then you've taught them how to do that as well.
Yes.
Like that's like a 2-for-1. Like that's
It really
great.
is.
Yeah,
it
and
is.
it's a great place
It's
to
a great
start,
protocol.
because a lot of people don't realize that their insomnia may be due to something else, or it may just be organic insomnia. But sometimes due to something else, you can start to, put that away as well and learn tools. I think cognitive behavioral therapy gives you tools for so many aspects of your life. And so it would help your insomnia as well as so many other things. I'm glad you asked on is it, how 6
Because
to 8
usually
weeks,
CBT is
yeah.
just cognitive behavioral therapy in general. Usually there's a starting and an end point.
Right.
Patients typically, and it varies, I'm sure, for each patient, but I didn't know if with the insomnia aspect, if it was shorter or longer.
Yeah.
And it depends on, I guess, like what the client wants to get into too. If you start getting
You might start
other issues, and then it could be longer, but just standard for insomnia would be 6 to 8 sessions.
70 to 80% effective is really huge.
It is.
So, this came, I have a master's degree in counseling, and I wasn't really familiar with the fact that I should be referring people to therapy for insomnia. I'm typically like, I don't really want to write the Ambien, but I really want you to sleep. What are my options here? And I was reading a book where it was about longevity medicine and people living longer and how important sleep is. And it talked about cognitive behavioral therapy for insomnia. And so I whip out my phone right away. Jane, what do you know? What do you know about this? Do
Read
you do
this.
Yeah.
I went and got the book immediately.
Yes. And she was like, yes, I can totally help people with that. And so I've started, telling people insomnia is not something you have to be burdened with. This is not, any more than carrying your anxiety everywhere. You don't have to continue to carry this insomnia. Sleep is so important. There is not an aspect of your life that will not be affected. Your chronic illnesses will get worse, or you will develop them. So many other problems. Mental health will go down immensely if you're not sleeping well. Amber and I protect our sleep. Like I wouldn't say I have tons of great self-care, but
I'm going to sleep.
I protect my sleep like a soldier.
And if I'm
for
moody,
you, do not interrupt my sleep.
Well, a couple weeks ago, I was just moody. Josh was like, "What's wrong with you?" I was like, "I don't know, I'm just being moody." He's like, "Well, why don't you go take a nap? Like, go to sleep. That always makes you better." And I was like, "I don't even know."
That is exactly what
I'm a little moody right now, and I'm not sure why. And he was like, "Well, go to sleep."
That's right.
Yes.
That'll help both of us.
That's right. I need a little bit of a break from your moody.
Exactly. Yes. Sleep important for lots of reasons, including good marriages.
My moody.
Right.
Yes. It is like, it's such a valuable thing. It matters so much. We would definitely empower people to take their sleep very serious. We talk about 4 pillars of health. We've mentioned it so many times. Sleep is one of those 4 things. Nutrition, exercise, sleep, stress management. These are the things that are going to give you more quantity and quality of life. And so if you are struggling with insomnia, seek out someone. Jane does cognitive behavioral therapy for insomnia. And you can seek her out to get more information on this. I would really encourage people to try this. I think if you're not sleeping, this would be life-changing for you. Any other pieces of information that you want to add on insomnia?
I wanted to ask you guys actually about supplements. What you feel about supplements rather than medications.
Yes.
Yeah.
We talked about magnesium.
Yeah.
And so magnesium is one that we often recommend. Melatonin is another one. Sometimes I'll have patients do 5-HTP in the mornings and melatonin in the evenings because 5-HTP mimics serotonin. So it kind of does back to the circadian rhythm.
Okay.
So those are a few things.
Yeah, I would be on board with both of those. Pure Encapsulated has one called Best Rest that I recommend to a lot of people. It is kind of a combo of things. A lot of people will have tried melatonin by the time they get to us because it's pretty well known at this point. I will say if you're not doing well with regular dose melatonin, you're probably not going to do well with triple that. So don't just keep taking more melatonin. And more is not better in almost every arena. So I like some of the combos too. And I like doing some of the nighttime teas. I think a lot of times there's a lot of good organic properties that are in the chamomile and some of the other teas that people use for sleep too. So I will recommend those as well. And how do I feel about it versus a prescription? I would rather you do anything that helps you sleep over the prescription sedatives.
Okay.
Prescription sleep pills are sedatives. And so we're sedating you. We're giving you something to knock you out. It doesn't give you more quality. It actually gives you less quality in your sleep. Everything that is approved as a sleep aid actually disrupts your sleep cycle. Trazodone is one sleep medicine. It's actually an antidepressant that we use for sleep because it makes people tired, and it doesn't really disrupt the quality of your sleep. Otherwise, almost everything else does. So that's an issue. Most of these things are habit forming, and then it gets to where it makes it worse in the long run. So you sleep worse when you don't have your sleep aid, and then you get to where you are, you will take my Ambien out of my dead cold hand because you can't sleep without it, and that gets very scary. And so I would rather not take away people's power and control. I'd rather empower people and give them tools to help them sleep better on their own. And I think the supplements really work more organically to help your body sleep. Your body wants to sleep. We are programmed to eat and sleep. When something is disrupting that, then something has gone wrong. And so I think getting to what is the core, when was the time that you could sleep, what has happened here, and if you go, well, I've just never been a good sleeper, then let's get you some tools to help you become a good sleeper. But we're not trying to get your body to do something that it doesn't want to do. It has to do this. This is our natural way of getting through things. We have to rest, and I think that we're not giving you better sleep when we give you prescriptions. I'm not a huge fan. I prescribe them, but I feel like there are better routes, and I think that the supplements as well as therapy are the absolute better routes.
Okay.
And it's not to say if you're on a sleep aid that you should cold turkey drop it. Like you can start cognitive therapy, and then we can wean you off of your sleep aid. And so if you feel as though I've been on Ambien a really long time, aging on Ambien's not a good thing. It's a medicine that we shouldn't take into older years. And so I really feel like if you've been on sleep aids, trying to do things to come off of the sleep aids is a great plan.
Okay. It reminds me, when you were talking about that we need to sleep, it reminds me of a place in that book where the doctor, I guess, that wrote the book was talking about, like you said, he was priding himself on not sleeping. And one of his friends said, if we didn't need sleep, evolution would have taken care of it by now.
Yes, it's so true. And the book is Outlived by Dr. Peter Attia, and he also said that people say a lot of doctors particularly, I'll sleep when I die, and he now says, well, you'll get there a lot faster.
Yeah, right. I have a friend that says that. There's plenty of time to sleep in the grave.
Yeah, exactly.
I'm like, oh, no.
You'll see the grave a lot sooner if
right.
That's your approach to it.
Right.
So there is a huge importance to sleep. We would really compel anyone who's struggling with that. It's a hard struggle. We would really compel you to start looking at what your healthy options are. And cognitive behavioral therapy for insomnia is, I think, a starting point.
And Jane does Zoom.
Place.
So even if you're listening to this somewhere else in the country, Jane is available for therapy through Zoom, which is a very nice thing that we can offer patients.
Jane, what are you on the great World Wide Web? What's your
on the interwebs? Jane and I know nothing that's appropriate for anything technological.
What is the name of your business if someone wants to Google you?
It is Infinite Endeavor Service Group, and the website address is ieservicegroup.com.
Okay, well, Amber's going to go take a nap
I know,
now.
I can definitely sleep.
We hope that you will use these tools and get a good night's sleep.
We like to leave you on a good note, so today's Tell Me Something Good is hard things. Doing hard things is such a challenge, and life is full of them. But they truly are something good, because when we survive the hard things, we know that we can do hard things and that we are better for it. There are so many times in life that I lean into the hardest things that I've been through, because I know if I could do that, I can do whatever's going on for me right now. So, hard things, difficult, but something good. Thank you for joining us today, and until next time, take care of yourself.